Hi, this is Alexander, Minnesota chiropractor, Dr. David Butler. When a patient has an MRI or a CT scan and the results reveal that their sciatic leg pain may be due to either a bulging disc or a herniated disc, they are usually given a round of steroid injections, and then they may or may not have a course of physical therapy, and finally, after those attempts fail, they are usually referred to an orthopedic surgeon or a neurosurgeon. And then they are faced with the life-changing question and given one option, which is whether or not they wish to undergo surgery. Now, numerous studies have explored that question, and a 2010 review of the literature on sciatica treatment brings us closer to an answer. In today's blog, I'm going to discuss a study which was published in the European Spine Journal. This European study revealed there is inconsistent evidence on whether surgery is more beneficial than conservative care. In this review, researchers evaluated several studies comparing surgery to prolonged conservative treatment for sciatica due to lumbar disc herniation. And they discovered that many of the leading studies were subject to a bias towards surgery, a bias which may have tainted the results. These findings go along with more recently published studies which found that, number one, in the United States, spine surgeries are done far more frequently, at least twice the rate that they are in Canada or in European countries, and over 5 times the rate they are done in the United Kingdom. And number two, often the likelihood of a patient getting a spine surgery is more frequently associated to how close they are to a spine surgeon than any other factor. Well, this European study looked at several studies and found that only 2 of the leading studies were considered to have low bias. Of all the studies done, only 2. One found that surgery provided faster relief of leg pain, but that differences between surgery and conservative care diminished after 1 to 2 years. And at the annual follow-ups, both groups of patients had improved. And additionally, another study confirmed that there were no major differences between conservative care and surgery in the long term. And despite the one study suggesting that surgery may provide faster relief, the initial benefit may be outweighed by the costs and risks of the surgery, researchers said. Now, this European study concluded that more research is needed to understand which patients may benefit more from surgery and which will benefit more from conservative care. And since both may be equally effective in the long term, but for now it's up to patients to decide whether surgery is worth the additional cost and risk. And just as a side note, to let you have an idea of the costs we're talking about here, a surgical disc decompression in the United States can cost as much as $189,000, which to me is mind-boggling when you consider the failure rate and the number of patients that become a statistic and are diagnosed with what they call FBSS, which is just the initials for failed back surgery syndrome. So if you or someone you know have been told surgery is your only option, give us a call. I'll be happy to sit down one-on-one with you and discuss your MRI findings and your options. Now, I'm not saying we can help everyone, and you may be a surgical candidate, but before you become a statistic, educate yourself. You can't undo surgery. Now, we've helped a lot of people avoid surgery, and I might add, at a fraction of the cost. And we've also helped a lot of people with failed back surgery syndrome get back into life. So finally, I'd like to say thanks for watching this blog. If you're interested in improving your health and the health and wellness of your family and friends, please visit us at backfeelsgreat.com. And once again, I'd like to say thank you for all the positive comments we've been getting on these blogs. I do appreciate that. So until next time, this is Dr. David Butler wishing you good health.